So hello everyone. My name is Nikki Young, and I currently work in private practice. And telehealth has actually become more of what I've been doing as of lately. I do have experience working with groups. I'll kind of give a rundown of things that I've done in up until now in the past, but as of lately, I do have a private practice. It's Nikki Young Counseling, and I am licensed in both Maryland and Georgia. And as I said, telehealth has become more so what I've been doing as of lately, not only because of the pandemic that we've been experiencing over the past over a year now, but even before that, I was getting more into doing telehealth with clients, and now it's pretty much a lot of what people are doing. But groups obviously are also being led through telehealth, through technology, but I think we're getting back to doing a lot of more in person. So this training is not based on, only in person or only telehealth. You can, utilize all of this in any capacity. So just a little bit more about me. I started out doing crisis counseling in domestic violence centers. I worked at a domestic violence shelter and started helping victims of domestic violence. I was doing crisis counseling mixed in with domestic violence counseling and some court advocacy as well. And after that, I moved more into working with substance abuse and addictions. And through both of those, also doing a lot of group work, self-help groups, support groups. And after that, I moved more into working specifically in mental health. And along the way, of course, even as you're doing crisis counseling, domestic violence training, court advocacy, you're still indirectly working in mental health, but I moved more into specifically working with mental health treatment. I was living in Tennessee, and I took a position where I was responsible for opening up 2 facilities in children's advocacy centers, and it was to broaden their services and to open up the services not just for the crisis counseling and the case management services that were already being provided by the children's advocacy centers, but this was also more so to bring about mental health counseling. And in that was also mixed in mental health groups and also support groups for youth and for women and for kids. And after that, I ended up going more into back into more of the substance abuse addictions counseling, and with an emphasis on mental health. And I was mental health director at one point of an inpatient facility, and it was for dual diagnosis, addiction, substance abuse, along with mental health. And then again, got back into where I am now and doing more private practice, usually or any more one-on-one counseling, individual therapy, couples counseling, marriage counseling, family counseling. And groups can be very beneficial. I do not currently lead groups right now, but I will say that they can be so effective that I actually do very much so recommend and refer a lot of my clients that I have today. I do offer them or refer them out to groups, whether it be mental health specific or self-help groups or support groups in some kind of way, because they can be extremely helpful. So with this training, yes, we can probably just jump into. Go ahead.
Okay, just want to interrupt for a minute.
Yeah.
She did write in the chat. Sorry about
Okay.
her audio isn't working. She's a new behavioral health counselor, LMSW. She doesn't have experience working with groups, and so her hope is to get greater knowledge on doing grief and loss support groups.
Nice. Okay, I see that. Okay, that's awesome. So let me, I guess, speak to that specifically, Leah. It's really awesome if you are willing to lead groups. And if sometimes people can shy away from doing them because I guess maybe there's an intimidation factor there, maybe because there's more people involved. But if you are willing to do it, they are great. Groups can be incredibly beneficial to people, and you can actually it can get a lot of enjoyment out of being facilitator as well. So yeah, we'll try and set you up with some more knowledge, especially with as it relates to this training with grief and loss support group. So, all right, let me close that out so that way I can see. All right, so this training specifically, grief and loss support group, facilitator training, and working with youth. I will kind of bounce around between some stuff geared towards younger kids, but I'll try to keep most things with the teenage group. And by all means, again, if there's questions like throughout, then definitely type some in there. Okay. All right, so the objectives that I'm hoping to cover during this training would be to provide basics of support group structure, provide some tips and tools for facilitating youth grief and loss support groups, define common terminology related to grief and loss, and finally, to provide resources for optional support group activities. There's going to probably be a lot more mixed in there, but those are the basics that I'm hoping that we can get to. Okay. A common question that you might have and or might have yourself and or might get from people is what are the difference between what's the difference between group therapy and support group? And there are differences, and they are important to know what the differences are, because one, you do not want to, if you're not a licensed clinician, you definitely do not want to be promoting a support group as either group therapy or a psychotherapy group, because it's not that. These are just some of the main differences between group therapy versus support group. So group therapy is actual psychological treatment with a licensed therapist as the facilitator. And the focus of those groups are actually to have people change. And support groups, yes, in that it's not that you're not getting support from psychotherapy groups, but the focus is really to usually help people change their behaviors versus just attending groups to have support from other members and or from the facilitator. Usually in group therapy, regular attendance is expected and participation is also expected. The group size is generally no more than 15 members at one time. A lot of times you'll see smaller than that, but usually they will cap, those groups are capped at no more than 15. And the groups also usually have an end date. I would say groups, probably psychotherapy groups, group therapy, probably going anywhere between like 8 to 12 weeks. You can have it obviously shorter or longer than that, but there is usually an end date. And another difference that I did not mention too is that if you have people who are in group therapy, psychological groups, those can actually be, there can be cost with those. They can be costly. Sometimes insurance can cover those as well. Support groups, on the other hand, here's some of the main differences with support groups. The group leader or the organizer tends not to have clinical training. This does not at all mean that you cannot be a licensed clinician and or have some kind of clinical training and lead these groups. It is not that. It just means that it's not required. Support groups are not psychotherapy or psychological treatment, and the focus is mainly to help members cope. And again, the big difference between group therapy and support group is when you're in a support group, you're not so much asking people's behaviors to change. You're not asking for any specific change. You're really there to offer support. You're there to offer coping skills for them. Support groups tend to have a particular theme and are much less structured. When we talk about themes, some of the probably more known, obviously, are going to be grief and loss theme groups. You can have your AA groups, your NA groups, your OA groups, all of the 12-step groups. Those are considered support groups. Like I said before, it's grief and loss groups. You can have hospitals anymore are providing a lot more support groups. A lot of people don't recognize that, but that actually as a referral source as well, if anybody's unaware of that, hospitals actually do offer a lot more support groups now, especially if they have specific diagnoses and hence the particular theme. If you are a cancer survivor, if you have any kind of specific medical condition, or even a family member of someone who has a specific medical condition, and maybe you need extra support as a family member, those are also ideas of support groups, or examples of support groups rather. So support groups, personal sharing and participation is optional. This is also, it doesn't have to be that way. I'll talk more about this later, but as a facilitator, you can set, any rules, you can set any expectations that you would like as you're the facilitator. It's generally speaking that when you are in a support group, that you're not going in there with the expectation that you are expected to attend or that you're expected to participate. But again, as a facilitator, you can have that as a rule if you would prefer that people do share or attend. But again, we can get into more of that later. Support groups can be large in size. There is generally no end date. There's ongoing participation, and sometimes members can come and go. Sometimes people can attend, maybe they feel that they have enough to cope with, and then they leave. And if the same support group is still going on, if it's just an ongoing group, sometimes they might actually experience another loss, for example, and then they return to the same group that they once were a part of before. It's not, again, not so much a general expectation that they are smaller end date and such as if psychological groups, but again, it's completely up to you what you decide to do with your group. Oops. Okay, just some things to consider when you are starting a group. As I mentioned before, telehealth is definitely on the scene, doing things remotely. I know that I'll give an example, when the pandemic first started, I have a client who is very involved with NA, and he was like, how on earth is this going to work? Because we're so used to doing groups in person. Everyone knows the location. People are generally there. You see the same people, et cetera. And it's never been offered remotely. A lot of groups that were, prior to pandemic, prior to the pandemic, a lot of groups were not any kind of, nor was it even anything considered to be remote. But now it has become actually a go-to, as we're obviously getting back more into doing things in person, sure, but this is going to be something more to consider than it ever has been before in history. So you do want to consider, you could even mix it up too. Are you expecting for your group, is it going to be in person only, or is it going to be remote? Or anymore, are you going to be mixing it up? And maybe you have people who come in remotely as well. That's definitely something that's different. So that's why I make sure to have this on there. And again, you can mix it up however you want to do that. Age range, this is definitely something that you want to consider in the beginning. And as I said, I would kind of bring in conversation that had to do with younger children and as well as teens. You want to consider the age range, because especially if you are doing an open group to where it is open to all members, that's fine, but you can still set, and you probably should still set limitations or rules or of such, as far as what age you are allowed to attend the group, because I think it goes without being said, but I'll say it anyways, like you don't want younger kids in with a teenage group, because you're going to be limited most likely in what you want to talk about. And, the language, of course, is going to be different. And of course, mental capacity of kids versus teens. So just consider the age range. Confidentiality, part of what to consider is not only, you probably want to have some kind of process, as if you are starting the group and everybody is coming in and they're starting and they're ending at the same date. You might have the very first meeting designated to talking about what the group expectations are, especially confidentiality. If you're having a group where people are coming and going, if it's an open group and open-ended, you want to have a process of explaining confidentiality. Maybe you meet with new group members for the first couple of minutes before the group, or I've seen groups where they just repeat confidentiality in the beginning of every single group, and it's just something that is said, and anyone who's new actually gets a piece of paper to sign that makes sure that that is documented that they're going to hold to confidentiality, that basically everything that's said and done in the group stays within the group. The piece of paper, I did not put any example of that, but if anybody at any time, if you wanted to email me, by all means, I can send you a blank copy of a confidentiality agreement. But that's going to be really big, that not only stressing it verbally, but you definitely want to have people sign, especially if they're of age, probably 16 and up. I know, check your state, because states are different as far as consent. And I think, I should not say which one, because I'm actually not sure, but I saw something that came across as of lately that said children as young as 12, I believe, can be consenting with mental health, but don't quote me on that, please. But just make sure that you're getting either a parental consent and or the actual person, the group member. And that way you can have it on file as well. But not only getting something in as a document, but you also want to stress it verbally as well.
And Nikki, quick question. When you talk about the age range, right, having cut off, are there any particular things that you consider when you have a cutoff as to the age range for a particular group?
Considering as far as what's being discussed, or
No, how do you determine where the cutoff is with the age? Like,
I
just
gotcha.
is it 3 to 8 or?
Yeah, I would think that maybe as a rule of thumb could be, maybe elementary school, middle school, high school. You do want to, you just want to mostly be careful that you don't have, too young of kids in with older, but you could probably base it on maybe elementary age, middle school age, and then high school age. I don't see where personally, I think that even if you're mixing middle school with high school, I think that that's still maybe too much of an age difference. So, I mean, again, I'm not, the end all, but I would say just be aware, and maybe you could just use the rule of thumb of, elementary age, middle school age, and then high school age. You think that answers that?
Yes, thank you.
Okay, sure. Okay, something else to consider. I've kind of already gone through this, but as far as membership, whether you want it to be open or closed, depending on depending on what you're trying to accomplish with the group, is it something that you see as open to the community and it's going to be forever there? It's not something that you plan on ending at any time. That I would say there would be no need for to make that a closed group, with again, like even with an end date. But let's say if you're providing grief and loss to maybe kids in a school who just witnessed either tragedy of some sort, you would probably consider membership closed, and or you would want to have an end date of some sort. But I think depending on what you're trying to accomplish, what it is that you're trying to provide for the members of the group would really drive whether a group is going to be open or closed, and also as well as whether it's going to be open-ended or have an end date. But again, you can kind of play around with that yourself. There's no rules to that. It's just based on whatever it is that you're trying to provide for people or wanting to have. Okay, something else to consider, prior screening. This could be part of when you're making sure that if you are considering the age range, of course, you want to make sure that before someone might come into the group, are there issues not only sorry, you don't hit the cutoff as far as the age range. But you also do want to be very careful if there's other factors happening here. Some you obviously might not know, but there's ways of. And then of course it gets tricky too, because if you are offering a group that is very open and open-ended, are you even going to be doing prior screening? But I think that they're especially when you're talking about working with youth, you're going to have more access to prior screening because they're not so much adults who are coming and going as they please. You're most likely going to talk to some kind of parent, some kind of caregiver, who's maybe calling or getting in touch with you to ask more questions. So if you can, prior screening, if you can ask a couple of questions as far as what's causing you to come into the group, did someone specific refer you to the group, and also I've seen in groups, and I've actually done this before too, before entering the group, can you please take either this survey, can you take this this depression scale, for example, and do you have any are you in counseling at the time? Do you have any other treatment that is being provided to you? Do you have any mental health diagnoses? This is not meant to say that if you do have other things going on, or if you are being offered services through somebody else, that you're excluded. It's just merely information for you. So that way, if there are red flags, and I'll get into more red flags and referrals later on, but prior screening can help the potential it can help keep from potential issues happening. If you have someone who either has, a pretty serious, mental health diagnoses, or that they are having a lot of behavioral problems, for example, and they might actually come in and be disruptive. It's not meant to say, that we don't want to provide something for you, but at the very least, if they, are still in the group, you can have that knowledge to know, okay, well, this is what so-and-so is going through. This is what diagnosis they might have. And so that way it's just informative for you. So prior screening, it's not necessary, but it is, again, just something to consider. Also, kind of going in with the prior screening, but not so much connected, but it's related. You want to have referral sources on hand as well, just in case there are kids, teens that do need extra resources. So for example, if you're in a group and you have and you see a need where a kid could benefit from more services, you want to be able to offer those services if possible, especially if you don't think that the group is giving them maybe everything that they could be benefiting from. But I'll go into more of that as well. But if you're having a group member who's really struggling, for example, and you think that they need more attention, then it would be nice if you have a list of maybe like local mental health therapists, or know where they're going to school, and maybe you have a name of their school counselor. You can, kind of say, hey, I think you should check out, go see your school counselor, or go see, this resource person at your school. Maybe you can talk to them a little bit extra, but just knowing what's available in your area and or community, just so that way if you see a need somewhere that's outside of what you're providing in the group, then you can give those easily to people. Okay, some facilitator do's and don'ts. These, again, nothing is rules for per se. It's just thoughts that that I had were important to mention. Get this out of the way. All right. So as a facilitator, you definitely, especially when you're working with youth, when you're working with teens, there, of course, can be confusion. Maybe they've never done a group before, and maybe they don't even want to be there. That's obviously very, very possible when you're leading any kind of group. You can always have to where someone is not so much wanting to be there. It's not their choice to be there, but you do want to engage with them and make sure that you establish yourself as the leader, as the facilitator, because it can become disorganized. This is somewhat of a difference when you're talking about psychotherapy groups or psychological groups, where the facilitator kind of takes more of a backseat approach, depending on what that group is trying to accomplish. But generally, the group as a whole, I don't want to say like takes care of itself, but you kind of move in the process together, where the facilitator really only speaks up if it's necessary. But doing a teen or a youth grief and loss group, especially being established as the leader facilitator, I definitely think that is necessary. You do want to stress the importance of confidentiality and respect for one another. I already got into that a little bit earlier. And again, this confidentiality and rules, especially, it might seem like it would take a little bit of time, especially if you're only doing a group for like maybe 30 minutes to 60 minutes or whatnot. It might seem like that might take a lot of time, but you can do that in like 30 seconds. You could even have it to where at each group you have like a printout. You could laminate something or, print something out and just go around the room. And at the beginning of every single meeting, you could have someone either volunteer or just say, hey, can you read, make sure that you read the confidentiality statement, make sure that you read the rules of the group, and then keep it moving. So group rules, you do, as a facilitator, you definitely want to establish group rules and again, repeat them. I would say at the very least at the beginning of each session or each meeting, but you can always interject if you have to, in the middle, if things are ever getting a little bit either out of hand or disorganized in some kind, you can always, bring up, remind everybody of the rules. And again, just for examples, are the rules being read at the beginning of each meeting? Are they being told to each new member separately? You could always have, meetings, like I said before, with every new member. You could always talk to them individually before they enter the group, if you feel like you wanted to do that. Okay, as a facilitator, you do want to embrace moments of silence. This I thought was really important to mention because sometimes it can be very uncomfortable, and especially either at the beginning of a group being established, or if you are having an open group where people are coming and going. You can have people who are, of course, teens. You can have them be very, I don't really want to talk. I've never done this before, but it can be uncomfortable, but it can also have the opposite effect of where if you just sit there and don't say much, don't do much, just scan the room, just kind of look around at people and not, making them feel pressure to talk, but, so not like, not having your gaze on them, for too long to where you're either, making them feel pressure to talk, but you're just kind of gently gazing around the room. And a lot of times you actually notice that people are more willing to speak up with that awkward silence than what you would expect. So, so try it out. I very much so encourage moments of silence, even if it's awkward silence. Moments of silence, yes, I just said encourages participation from those who have been hesitant to speak. Okay, we'll go into the do nots. So as a facilitator, you do not want to interject personal feelings or emotions too often, or if at all. This is not to say that you can't do it. It is just that you want to be aware of what you are saying, why you're saying it, when you're saying it. And the reasons for such is it can actually make participants feel that they don't have to really engage, because maybe they're just going to feel comfortable with, oh, well, so-and-so, group leader, they're just going to say things about themselves, or, they'll chime in whenever we're not. But you also want to remember that, especially if we're talking about, a teen or a youth, grief and loss group, it's about them and their experiences. And you can, yes, provide some guidance, you can provide some examples for them, and it can get conversation going, but I very strongly recommend that you do not do too much of the interjecting stuff from yourself, because it could take away from their experiences, and or it could take away from what the group could become with all of the teen or the youth's experiences themselves. As a facilitator, do not be too big. I kind of already explained this. Do not be too big of a facilitator presence as to take away from group members interacting and engaging with one another. I have the word universalism on there, and I'm sure that everybody's probably heard of this concept before, but the main I guess not main, but a very, very big benefit to groups in general is that there is, especially when you have support groups with a theme. So teen or youth grief and loss group, you are in that group because all of you have experienced something similar in regards to a grief and loss in your life. And the benefit of the group as a whole is that they can actually, group members, the youth, the teens, they can find comfort that they're not the only ones going through what they're going through. And as a facilitator, if you are too big of a presence, for example, if you're providing too much of yourself, you would actually be hindering that universalism from happening, because it would be a little bit more geared towards you and your experiences versus the teen or the youth group members to be able to be feeling that amongst themselves. And the good thing is that obviously with youth, it's good that they want to feel that from their peers. They don't necessarily want to, not to say it can't be beneficial, but it is better for them to feel that universalism with their peers versus with grown-ups, adults. Again, I already said, do not be afraid of moments of silence. I cannot stress that enough. Okay, do not shy away from mixing up material. The beautiful thing of support groups is that there's really, you have a lot of freedom to do what you want to do in them, and especially working with youth, especially working with teens. You could even do a group. I mean, in the beginning, it could be designated to, hey, give me some ideas, write it all on a whiteboard, have everybody write something down and put it in a hat, put it in a jar. You could actually ask for their opinion of what kind of activities would you like to do? What kind of things would you like to see happen in this group? And for sure, it can, I have it even in bolded, it can keep them engaged with different ideas versus if we, as adults, I mean, I don't think that you're so much going to be losing our attention if we go to a support group and everybody is just talking the entire time versus, teens or, a younger audience. You do want to be able to mix up material because I think they're going to be better. They're going to be better at keeping attention. They're going to be better engaged with you. And the benefit of asking them for their input is because they're going to definitely pay more attention if it's their idea, and or if you're relating to them in that kind of way. So keep in mind that definitely you can mix up material. You can do educational, you can, by all means, there is benefit to doing educational material sometimes. Like if you're doing a group where it's more so, I don't want to say the lecture, but it is more of a teaching moment. You definitely do want moments like that, but you want to mix it in and don't make it all educational, because you're probably going to lose a lot of interest with teens or with youth. Some free flowing, I say, just pretty much just allowing some groups to just say what's on your mind. Maybe this time we just go around the room and say anything. I don't even care what it is, just how you're doing. How did your day go? What's a thought? What's an emotion that you have? Those groups can obviously be very beneficial as well. But definitely embracing the flexibility that you do not have to follow a certain curriculum per se, unless you do have a curriculum to follow. But generally speaking, support groups, you can pretty much choose the direction of where you're going with them, which is great. Okay, just a couple of things about grief and loss in youth, just a couple of quotes that I found that I thought were interesting. Signs and symptoms differ with age. Older children with concepts of permanence of death and personalization of their own mortality experience more anxiety, depression, and somatic symptoms than do younger children. But younger children also experience profound reactions to loss and may display feelings of sadness, anger, crying spells, feelings of remorse and guilt, somatization, and separation anxiety. Children 5 and under do not necessarily understand how death differs from going away, and death may not have meaning to them, but they do understand when something is lost, and this may be distressing. Younger children 5 and under, as they live in an egocentric world, may also assume that they are the cause of such loss. And just kind of relating this back to what I was saying before, given, just these brief examples of younger kids versus teens, they're experiencing things differently based on, what kind of what stage, stage of life they're in. If they're in like a younger kid stage versus, teenage, they're going to be looking at death differently. They're going to be looking at crisis differently. They're going to be looking at, trauma differently, whatever their grief and loss is, they're going to generally be experiencing things differently, thinking about things differently, feeling things differently. And it could be very confusing if you were to mix ages that are looking at, feeling at, experiencing things differently. And it could probably do, I don't want to say harm, but it might not do as much good for them for it to be more of a confusing kind of thing. And you probably have to be doing a little bit more clarifying if that were the case as well, which you don't really want to have to worry about, clarifying this and that. So just another example of why it's probably best to make sure that your age range is appropriate. Okay, just a little bit more about grief and loss specifically for youth. Adolescents today are encountering death and loss more frequently than ever before. This is a sad thing, but it is the reality. I did read, this was 1994. Research indicated that 90% of junior and senior high school students experienced a loss associated with death. That was over 25 years ago. I did not look to see what the percentage would be now, but you can pretty much guarantee that it's going to be at least 90%, and that is a big number. So you consider what all is considered even crisis. It's not just death. And so of course that 90%, I imagine if it's not 100%, would probably be as close to 99 or as close to 100% as you can get. But again, not my statistics. So I'm not saying that for a fact, just guessing. When you consider what is grief and loss, it's definitely not just death. There are a lot of different things that can be considered, that can be considered a loss that youth, that teens are grieving over. You could have job loss within the family, destabilized families, separation, divorce, illnesses, maybe not death, but someone experiencing a significant illness, loss of routine, loss of time spent with family, loss of social interaction, loss of friendships or relationships, and anything that is some kind of disturbing of such, some kind of loss with social media. It's horrible to think that you unfriend someone and that can be considered a loss anymore. Who on earth would have thought that we would be saying something like that? But it's there. I am right now specifically working with a young girl, and she is really having a hard time and getting over that she was not asked to a dance, and taking it as a loss, and a big loss. And I'm not minimizing what she's going through at all, but she has also been through a lot of very serious losses in her life and trauma, and this one is still up there. And it is because of the social aspect, these social implications, that it is that she feels, of course, like she's not fitting in. She feels embarrassed. She feels that that it is something that people will look at her differently. So yeah, just another example of that. Especially, I did want to say, related to what we've been going through in the pandemic, with having to do remote learning. Even there has been an increase, of course, in youth, teenage, my gosh, just youth in general. This is kids, teenagers, with their having to do remote learning. This is a loss in itself, that they're not getting these social interactions with their peers. They're having a loss of routine. There are more like attention concentration issues now, because they are having to learn differently. There's a lot, especially going on right now, that we can relate differently to a loss, and grief and loss, that maybe what we would have 5-10 years ago. So there's a lot to consider, and this is definitely not, this list is not the end. I mean, this is just certain examples that just popped in my mind, but for sure there's definitely more. Also, let me know if I'm going too fast. I can get to talking and I can go very quickly. So hopefully that's not happening, but just chat on there and let me know. Say, slow down, please. All right. So just some common terminology with associated with grief: bereavement, a state of being caused by loss such as death. Grief, an intense process of thoughts, feelings, and behaviors caused by a loss. And mourning, the culturally patterned expression of the bereaved person's thoughts, feelings, and behaviors. And then the grief model that most of us, I imagine, are familiar with. I figured it was probably worth putting this up, but I don't want to spend too much time on this, because I don't think that it's so much necessary. There are a lot of different models out there now. There are some that have been, that have, taken this model and just expounded on it. Like, this is definitely not the one and only. This is not the end all. There have been a lot that have been based on this one. So you can look up, and find a lot more stages of grief models anymore. But this is just the general one that comes to mind. Okay, we'll just go through these. The 5 stages of grief, as the Kubler-Ross model expresses it: denial. The thought associated with that is, this can't be happening. Anger, why is this happening to me? Bargaining, I will do anything to change this. Depression, what's the point of going on after this loss? And acceptance, I know what happened and I can't change it. Now I need to cope. Keep in mind too that I think it's also very important, when you're leading a group with teens, with youth, that they understand that no matter what stages of grief, whichever model that you might be teaching or that you might be referencing, it is not anything that it is said you have to go through this, and this, and in these kinds of ways. It is, you could be all over the place. You could experience one before the other one. This is not, you have to do denial, then anger, then bargaining, then depression, acceptance. You could bounce around between all of them. You can have different emotions than your peer. You can have your grief can look way different than your peer sitting next to you. You could be in acceptance, and then bam, something else happens, and you're back to depression again, or What if, one loss happens, and another happens, or you are somehow in acceptance and you're feeling okay, and then you're triggered by something, and then you go back to anger, for example. So I think that especially with teens, they need to, in a sense, have permission that you're not only allowed to feel however you feel, but you can feel at any time. There's really no set, there's no set model for how your grief is going to go for you. Some general comments that I found listed, just some things that are generally said by teens in mourning. Again, not so much talking about death specifically, but just different losses across the board. No one at school understands anything. I feel very strange. Sometimes I feel like a totally different person since my dad died, and other times I feel like nothing has happened. I hate it when people say I'm sorry. Will I ever feel better? I always feel like crying, but I hold it back and then I just shut down. I don't think I could ever walk into another hospital. I just don't belong anymore, anywhere, home or at school. People call the house and ask me how my mom is doing, not how I'm doing. I hate the way my family has changed. Some more stuff on teens and mourning. Teenage years are obviously very difficult for all concerned. Death or loss in a teen's life is a serious challenge. If the challenge is well met, it is an opportunity for great growth. If not, there's a possibility of a troubled life, or the very worst scenario could be suicide. Suicide rates are obviously up. Anyways, but everything that we're going through, even pandemic related, as I've alluded to before, even that is causing suicide rates to be higher as well. So when you consider leading a group with teens and with grief and loss, I mean, again, if the challenge is well met, it's an opportunity for great growth. Very, very good opportunity to help a teenager, to help a youth, whatever age. It is a very good opportunity to help them in whatever they're going through. And at some point I was going to say, and why not here, I guess, but you might experience in groups where you might not think that someone is being helped, but do not discount that. You never know how anyone, for that matter, but especially youth, you don't know how they're going to respond. Do not necessarily have expectations, because it could be the most quiet, reserved one who does not really feel like participating ever, maybe even sits with their eyes closed. I have been in the past, I have actually kept myself from asking participation because I had to check myself in, well, just because I might be thinking that they're not being helped, I'm not going to just make assumptions, right? And I had one kid specifically where, their body language was just like, I am not here. I don't want anyone to talk to me. I don't want you to look at me. And lo and behold, like after weeks, it actually turned out that no, they were listening. Their eyes were closed, and they looked like they wanted to be anywhere else but there. But they were actually being helped. Now, can it have detrimental, can it be somewhat confusing for other group members? Sure. So you do have to kind of walk that line between if something is disrupting or if it is kind of causing issue, where someone sitting, and having their eyes closed or arms crossed or whatnot. Like sometimes, yes, you do need to address that, but you do want to still keep in the back of your mind that it might not be what it seems. So just kind of a note to groups being obviously a great opportunity for growth. Teens' intense feelings threaten their sense of control that is so important for their sense of independence. They often do not yet understand that these feelings will pass and will not destroy them. They long for closeness with other people, yet that same intimacy requires them to be vulnerable and childlike. This vulnerability is difficult for them to accept, so they shun intimacy at the very same time they pursue it. And that can also be very difficult to understand how to deal with. And it's very important that when you're leading groups with teens, especially a grief and loss group, that you give a little bit more freedom, that you have a little bit more acceptance, a little bit more just lost the word that I was going to use. Sorry. We'll just say that you give them a little bit more leeway, because they are struggling between, I want this closeness with others. I long for this universalism with my peers, whether they realize it or not. But at the same time, that confusion, the hurt, the pain for whatever loss it is that they're going through can also have them feeling like, I don't want anything to do with anybody or anyone for whatever reason. Not always are you going to deal, with that kind of dichotomy, but it is something to consider when you're working with teens. Teens are more adult-like in their cognitive development than children. Again, another reason why you would want to keep age range as a consideration. Children ask about death concretely. What happens when we die? Teens think about the meaning of life abstractly. What is real? What is it all about? Because of their abstract view of life, their volatile emotions, and their impulsivity, teens are accident prone and at a greater risk for suicide. So just another thought about how serious things can get. Because of difficulty concentrating, school grades typically dip for a period when children of all ages are grieving. Teens, however, are also preparing for either college or the workplace. Some are actually already working, depending on how old they are. A dip in school grades is anxiety provoking for the student and parent or caretaker, and a concern for the teachers. So another thing, when you're in a grief and loss group with youth, with teens, you do want to also consider there's a lot going on in their lives that is not just them attending the group and talking about their loss. They've got stuff going on at school. They obviously most likely have something going on at home, whether the loss had anything to do with their home life or not, but they're kids, so they're still living with someone because they're not on their own yet. They've got grades, they've maybe have extracurricular activities, and so keeping in mind those aspects, of course, when you're leading the group as well. So group engagement, ideas for involvement. We'll kind of get into more like specifics of what you can do during the groups. Just some ideas. Again, there are so many different activities. You could look up so many different websites for resources. These are just some of the thoughts that I had that have worked well for me in the past. Again, so facilitator, you are going to be seen as the leader, as the teacher, and you could have things be educational. That is never, you cannot go wrong with that. If anything, I think it's absolutely necessary for a lot, because you do want to make sure that your kids, that the teens, youth, that they are educated on grief and loss, because otherwise they might not know any better. They might think, that they know what constitutes for a loss, or what constitutes for even healthy grieving versus unhealthy grieving. And you do want to pick some topics and educate them. And it's not so much you don't have to, of course, sell it to them as, educational, but it's more so about, hey, let me help you. So that way you best understand that pretty much what you're experiencing is most likely normal, versus maybe they have thoughts of whether what they're feeling is abnormal. So you could do that in like classroom type lecture. This doesn't have to be, of course, desks set up like a classroom. I would always recommend that groups are done in a circle, so that way it's not feeling like a classroom. Now, I've led groups in a lot of different places, a lot of different spaces, and sometimes you got to take what you've got, right? So if you have a classroom setting, and let's just say like, chairs and tables and such are set up to where you can't move them, that's fine. But I do always recommend that if you can get some kind of circle going, then that's going to be your best bet, because it actually helps with more sense of community. It helps with more participation. Whereas if you think, classroom, well, I can just sit in the back and I can just hide, behind all of these other people, and no one's going to call on me, kind of thing. But when you're in a circle, it helps to where you can actually see everybody, and everybody is no one's hiding, if you will. Worksheets are always great. I think that along with getting ideas from your group, you could ask them, do you guys like worksheets? Do you think, if I got you some worksheets, what kind of topics do you think that you would like? Do you want things to color even? Like, would you want to do some kind of, therapeutic coloring, if you will? But especially with worksheets, you want to read the room, and sometimes worksheets with youth can feel a little bit too much like school. But it's not that they can't be helpful, but you do want to make sure that if you do worksheets, that they are not too school-like, too educational, to where it seems like homework or it seems like class, because you're not going to get as much participation. And I don't think that that's so much a conscious thing per se for them. I think some of it is, of course, but I think that it also might be a little bit more of like on a subconscious level, that, also too, you might even have groups where they're coming after school, or if you're even leading a group in, school, it could be that, it's kind of treated like another class. So worksheets, I have kind of a disclaimer on those. They can be extremely beneficial. They can be very informative, but you do want to use those maybe sparingly. Art, music, I find that art especially can be very fulfilling if you just bring just blank pieces of paper and markers, some kind of paint. You want to make sure that you're not giving it to a bunch of little kids. You might have a mess with that. Not to say you can't do it, but just be aware, of course. But music, you can ask, you can ask for ideas. I know I've had some groups before. I've even done this in, sessions where, okay, we can choose, what maybe we want to have some kind of music on in the background. I would say, of course, age appropriate, maybe know what it is that you're going to be playing just in case that it's not inappropriate. I'm not saying have like super strict rules with that, because I mean, some stuff obviously they're already listening to, but of course you use your judgment for what's appropriate, what's not. But these are art and music and such. Those are definitely things that you can get interest, you can get involvement from youth, especially if you utilize those in some kind of way. Free association, I kind of already got into that earlier. Just examples of if you're going to do groups that are, you could do groups that are only free association. It doesn't have to be that you incorporate all of these other things as well. But if you have it set up to where you're doing this, it's except talking over each other, it's pretty much just whatever comes to mind. Anybody share who wants to share, you can talk. You can ask people to take turns around the room. Again, another aspect of support groups is that you can decide, of course, but if one of your youth, wants to pass, they don't really want to take a turn, they can just say skip or say pass, please, or whatnot, and just keep going to the next person. But again, too, you make those rules. And also too, with feedback, I think that you might want to consider if you're doing more of like a free association kind of group, do you want them to give each other feedback, or do you want it to just be, okay, everybody, today we're just going to say what is on our minds, but then after that, we're not going to have any comments afterwards. You could do that. Or you could just allow comments to happen. It's completely up to you, but either one works. And again, with free association, there's really no such direction with that. It's just open discussion. You could have guided discussions. This doesn't necessarily have to be so much that you as the teacher per se, but you could at least lead a group in, here's the topic that we're going to stick with today, and let's only discuss, this specific topic. You could even have different like a different team each week. You bring in the next topic, or you start out the discussion, and whatever it is that you start, that's the discussion that we're going to have for today.
Oh, just
Go ahead.
I was just going to add, I remember when I started doing groups, it was because you encouraged me to start doing the groups.
That's right.
And you gave me some really good suggestions as well. Like even creating a list of different possible topics that they may be able to connect with, and having that like in a bag, so they can't think of anything. They were able to pick a topic, someone to pick it out, and that was helpful as well in case no one came up with anything on their own.
Good point. Thank you, Channing. Yes, and especially when if you are again, you can kind of read the room, if you will. If you've got a bunch of talkers, like, you might not necessarily have to take that. But yes, Channing makes a really good point. At any given time, I'm so glad that you said that. At any given time, I don't ever have if I don't really have a direction per se, I always have something like that, like in my back pocket, if you will, to always have kind of a list of things that you could be doing, and or make like a some kind of bag or such, of topics, or everybody writes something at the beginning of the group, and then it just stays, it just stays like in a basket or something. And if you have, if you guys are all having a hard time, deciding what to do, then you always have a backup plan. So absolutely. Role play. not so much a favorite, but you could still get some good stuff from it. It can be humorous, it could be completely emotional, but that doesn't make it a bad thing at all. But role play, I would say, don't so much just throw it out there like we're doing role play, like without having any kind of direction. You could write a script. You could give, you could actually give specific topics, but role play could be a really good, a really good idea to do. But again, that's up to you also. I personally tend not to do role play myself. Or I don't even like ask to do role play. And so maybe that's why I shy away from it. I don't know. So that's obviously a me thing, not a group thing. But again, too, if you're not really feeling it, then it might not be something that might work out the greatest. But if you like it, if you want to do that, you like the idea, then by all means go for it. I think it does have its place, but if you do it, I would say come prepared, because especially you might get some hesitation on, I don't really know how to go about this, and that's where scripts, of course, could come into play as something beneficial.
Yeah.
We go ahead.
Oh, I was just going to add, I was working with a group of teens, and I guess it's a role play exercise that I would do. I would bring a list of feelings and
Mm.
have one student come up and they would act out the feeling. We had to guess which feeling it was. It was kind of like a good icebreaker in the beginning of like starting a group to use. So that I think can be another example of role play, but it's easy to kind of get them started.
Absolutely. We kind of already did with the art and music, but entertainment, use of technology, just a couple of other examples. You could do for even some educational stuff, more things to relate to teens. You could do movie clips, songs. This could also not just to stimulate discussion, but it could also be educational. Again, as you are asking for their input, whether you're asking, hey, share this song that you've been listening to or whatnot, that also kind of incorporates that universalism, because more times than not, if they're talking about, either the latest artists or even if it comes to like celebrities and such, like pop culture, whatever, that they're going to be most likely in tuned, to all of that. And so even that kind of universalism and to me would be speaking in a different language, but to them, the universalism can definitely be helpful. And again, kind of to that point, youth tend to engage more with more relatable material. And so you want to be aware that if you with groups in general, but grief and loss groups with youth, you want to have them engaged, but you also want it to be relatable material, or else it's not so much going to be the best help that it could be. So mix in, of course, some educational stuff that is maybe the boring, more of the boring things, but you do want to mix it in with other things as well, so that way they feel like they're getting a lot more out of it. Okay, so these are just examples of a couple. Channing just gave a good one. These are a couple of different ones that you could use. This one's called "What Do You Need?" It's pretty simple. None of these really have to be really difficult, but the basics of this one are just that you're asking the teens to pretty much tell people what it is that they need right now, or in that moment, what they need in general, what they need from the group. And it can be some pretty other discussions, could even come from this. But I'm not going to read through all of this, but the general premise is that when people are grieving, a lot of times, especially youth, that's why I gave this one, because I think that it fits really well to this type of group specifically. Many people do not let others know what they need because they feel they will be burdening them with their pain, or they make the assumption that people should already know what they need without telling them. And it's also that we want to have kids involved, and we want them to feel like they can ask of things. We want them to feel that they're being heard. We want them to feel that they also are responsible enough to be able to request certain things. So that is kind of the premise. This kind of hits all of that. So what you would do in the group setting, of course, is discuss typical feelings associated with grief and loss. Examples: anger, sadness, confusion. After discussion or defining those various feelings, just pick two. You could pick more. It doesn't matter. You could even pick just one. Again, no real rules to this. And then you would just go around the circle and you would say, what is it that you need from this group when you're feeling blank and blank? And I would keep the feelings the same. That way you're having everybody talk about the same things. And then each person answers. And then as the group facilitator, you could ask clarifying questions. You could make comments or not, and just let them move on. That's, again, it's up to you. Having teens tell the group what they need is an important exercise to do by the second or third meeting. And this way they can understand how to express their needs. It encourages communication and enforces the importance of being responsible for our own needs. So those are kind of the reasons behind it, but you definitely want to do it by the second or third meeting, because it leaves more opportunity for them to get what they are looking for, or getting what they actually need. If you wait, until the second to last meeting or the last meeting, it kind of doesn't make sense for that to happen. So I would, if you do this exercise, especially, you want to do it more so in the beginning, or in the beginning of a person's time in the meeting, if there's no end date. Okay, another one was I've never done this one before, but I thought that it sounded like it was fun, and like not messy, but like something to like not messy, like fun, but messy and easier to clean up. So let's go through this one. So Kleenex toss. Channing, do you still have me? It just said my connection was going out.
Yes, you're still here.
Okay.
You went out a
Okay.
little bit, but you're back. Yeah.
Okay. Let me know if it gets bad. I don't know why that happened. Okay. So Kleenex toss. You basically give a box of Kleenex to each youth, each teenager, and you form a circle, and everybody sits on the floor. And basically what you do is, with all of their empty boxes, I kind of had an idea that I wasn't sure if this description meant that they're emptying the box, like just from speaking one time, or if they're speaking multiple times, and each time that they talk during the group discussion, they are pulling out these Kleenexes from their box. So again, like, you can do whatever it is that you want to do with this, but it appears that they're emptying the box in just one discussion, which would be fine. But again, I did just want to say, like, there's not a rule to this. Like, you could do it throughout the discussion, and then every time, it actually might be, if you tell them don't do it all just in one comment, it might even foster them to, or might even encourage them to talk more, because maybe they'll want to have another opportunity to pull those Kleenexes out of their boxes. So something to consider, I guess. So you basically just continue them expressing all of their feelings until everyone's box is empty, and then you just do like a debrief, if you will, and ask them how they felt when they first entered the room, and then how they felt after tossing out all of their Kleenexes from the box. And it says most of them will experience an increase of energy and a lighter, happier feeling, and I could see that. Then after the discussion, this is where I think that it gets heartfelt, especially for whomever you're going to choose, to put in the middle of this circle. But you ask for one of the teens or one of the youth to sit in the center of the circle, and then on the count of three, everybody like throws all of their Kleenexes on top of the person that's in the middle, and then they all express good wishes for them. And what I liked about this is, and I agree, for a lot of youth, this could be their first experience where they're the center of attention in a positive way. So I thought that was a good one to use. Again, these are not, the only things out there. You can find plenty of resources. I have a couple of things listed on here as far as activities go. You can even make up your own. Again, no rules. Okay, so when to refer, this does happen where you might feel at some time where there might be an inappropriate, for whatever reason, there might be an inappropriate youth that is involved in the grief and loss group. Again, with loss, you never know how it's going to affect you. You never know what could come from it. So you could be experiencing a lot of different emotions, a lot of bothersome behaviors. So you do have to be aware that it could get to where you have to ask someone that they either kind of change behaviors and they can stay, or you might actually have to ask them to leave the group, or you might even mix it up and say, well, I need you to go and seek, outside help, and you can stay in the group, but I do want you to also see somebody else or do something else on top of what we're doing in here. So let's see. Yeah, this is back to, having on hand. What you could do is a referral. If you're referring somebody outside of the group, it's definitely going to be helpful. As I said before, you want to have resources on hand just in case you do need to guide them and or their parent or caretaker to get outside help. You could have a list of other resources, of course, but don't think that just because there's difficult or inappropriate behaviors happening or whatnot, that it means that of course you have to kick them out of the group. It's not so much that, but you do want to be aware that these things could happen, and you either have to have a difficult discussion with them, and or you would have to decide whether or not it's appropriate to keep them in the group. Discussion with them before removal and or referral can be effective, or change the situation. So consider such in a one-on-one meeting before taking any action. And some examples, of course, of disruptive, inappropriate behaviors, definitely not limited to this, but you decide, again, like rules of the group, and decide how lenient are you, how strict are you, and you can very much so put this out there. Look, like we have zero tolerance of XYZ behaviors, or we will have a 3 strikes. I don't know. Again, it doesn't really matter, but whatever is appropriate to your group, because one size does not fit all as far as when you're leading these groups. So you decide, but of course, you don't you don't really want to put up with excessive, especially foul, inappropriate, disrespectful language. Talking over others is a really big one to me, because the groups can get out of hand. And also when you consider, youth in a grief and loss group, and it's a very emotional topic. And especially if you have either side conversations going on, someone talking over another teen, when they're trying to talk during this group, it can really do some damage, because it can minimize what it is that they're trying to say. If you have like side conversations, if you think about the whole social aspect of, what teens pretty much struggle with, I don't think that there's a teen out there that doesn't, struggle with the whole, clicks and, well, maybe so-and-so over here is, talking over here. Are they talking about me? Like, what I'm saying is not important or whatnot. So talking over others, I should have probably put an asterisk over that. That one's a really big one for me, because I think especially working with youth, it has different implications for it. So keep that in mind. Name calling, aggression, of course, you decide, but those are definitely big ones that are probably, especially aggression, maybe one strike you're out. I don't know. But again, it's whatever it is that you decide for your group, and depending on the situation, I guess. Tardiness, distractibility, you can decide no phones, no technology. I know that phones are a huge issue. Schools, I believe, I think schools anymore, from what I've understood from, teacher friends, from clients, from just hearing, a lot of times phones are kind of overlooked anymore, but I would highly recommend that phones are kept away, because you could have them texting each other. You could have them, looking things up on their phones. Music could accidentally play, or, phone call could accidentally come through. I'm not saying like everybody put their phone, in a bucket and you can get it back like after the group. I'm not saying that you have to be that kind of strict, but I do think that it's very important to note that that technology of any kind can be extremely distracting, especially with teens. So back to the participation, again, depending on what your expectations of engagement in the group are, participation might not be an issue. If you're expecting participation, then you definitely want that to be, you want that to be talked about. So that way everyone knows that that's an expectation. But otherwise, if it's not, then it's not a problem. But I just put that up there just in case, if you're running a group where participation is required for whatever reason, then sure, that, could be grounds for referral of some sort, because it would be going against a rule. Anything outside of established group rules, pretty much. So again, that list is not limited to those kinds of things. I mean, there's plenty of things, other things that could be on that list as well. Okay, these are just a couple of online go-tos that I have. Some of the things that I got from this presentation are from these websites and or ones that I've used